Hello and welcome to our new topic. Today's topic is about an important process that may determine our decision-making in a variety of clinical situations. We will talk about drug absorption and its determinants. Let's start. The learning objectives are shown. Please take a look. Before we understand drug absorption, we need to understand which path a drug adopts in its journey inside our bodies. What obstacles it faces to accomplish the mission assigned to it. Of course, the first thing is the drug administration and its absorption. A drug is administered using different drug formulations, also called the drug dosage forms, including the solid forms, the liquid forms, the gas to introduce the drug into the body of the patient by a variety of forms, such as tablets, capsules, syrups, creams, gels, injections, etc. What happens when the drug is absorbed? Well, it goes to blood circulation and circulates as a free drug. Only a part of this remains free, and very quickly. The majority of drug molecules bind with plasma proteins, which are albumin and globulin, acting as a reservoir for on-demand release of drug later on. So what can happen with the free drug molecule? Well, the free drug molecule is free to act. It binds to its receptors and acts on different organs, different tissues, and brings about all the physiological effects. Similarly, only the free drug would be metabolized and excreted. Thus, there are two groups of processes through which the drug passes. First, the pharmacokinetics, and the second is pharmacodynamics. The pharmacokinetics includes drug absorption, distribution, metabolism, and excretion, while pharmacodynamics is related to drug action and its consequences. Now, we need to understand what are the factors which affect drug absorption. Remember, the drug absorption takes place through biological surfaces. If a drug is taken by mouth, it goes to the intestine, from where it is dissolved in the intestinal juice and then absorbed through the intestinal mucosa. If we administer the drug through an intramuscular injection, it goes into the muscular tissue, from where the blood circulation slowly takes the drug away. If we inject the drug under the skin, there are capillaries or very thin blood vessels which will carry the drug. A capillary wall has an outer connective tissue layer, and an inner endothelial layer through which the drug molecules can pass and enter the bloodstream. If a drug is inhaled, then the drug passes through the juxtaposed lung alveolar epithelial surface as well as the alveolar capillary endothelium for absorption. Now let's talk about various factors which determine drug absorption, and can be divided into two broad categories. Firstly, those which belong to the drug, and secondly, those which belong to the patient who receives the drug. The molecular nature means whether the drug molecule is water-soluble or lipid-soluble. That is, polar or non-polar. If a drug, taken by mouth, is more water-soluble, it would dissolve very well in the intestinal fluid, including the mucus layer over the epithelium in the intestine. But it will have difficulty passing through the lipid layers in the cells and tissues. On the other hand, if a drug is lipid-soluble, it will poorly dissolve in the watery intestinal fluid and may be excreted unabsorbed. Thus, it has to be a very sweet spot in which it has to be soluble enough in water as well as in the lipids to allow dissolution in the body fluids as well as passing through the lipid membranes. Next is the size of the molecule, which implies that if the molecule is very large, it cannot be transported across the absorption surface. Thus, the drugs with very large size cannot be given orally because of poor absorption, and has to be given parenterally, maybe through an IV infusion. Finally, there comes the charge of the molecule. If it is a charged molecule, positively or negatively, regardless, if it is charged, it will dissolve in water-based body fluids, but will not be able to enter the cell membranes in the target tissues. Then comes the dosage form. What dosage form are we using to administer the drug? For example, if it is a slow-release formulation, then the absorption will be slow. There are patient-related factors too which may affect drug absorption. For example, a drug may be absorbed much better if given parenterally as compared to orally. In certain diseases, the surface area available for the drug absorption is reduced. For example, in conditions where people get their parts of intestine surgically removed, then the surface area available for drug absorption is reduced. In yet other conditions, the blood vessels supplying the absorptive surface may become thickened, constricted or dilated, modifying the rate of drug absorption. Sometimes, there is insufficient time for drug absorption, such as in diarrhea and vomiting. Drugs may also interact at the site of absorption with another drug or food taken concomitantly. They may make chemical or physical bonds preventing them from being available to get absorbed. Why? Because together they may become a large molecule, or get charged, or change its polarity. While some drugs are better taken with an empty stomach, others are better taken with fatty food. Some drugs should not be taken with multivitamin and multimineral pills, while others should not be taken with dairy products, milk and cheese, and so on. While many drugs follow the principles of simple diffusion across the membranes separating various body fluid compartments, others may need carriers or even energy-dependent transport system. To make it even more complex, many drugs are pumped out of a body fluid compartment by efflux pumps, such as P-glycoprotein in epithelial cells. This slide compares the blood concentration time curves for various routes of drug administration as coded with colors. Please note that this is a schematic representation for a typical curve. Compare 3 types of injections: intravenous, intramuscular and subcutaneous in that order. See how inhalational route places itself between 2 types of injections. Note that intravenous has the quickest onset of action and highest yield of the administered dose, while topical has the lowest values. However, a quick onset and highest peak does not mean a sustained therapeutic efficacy. Compare intravenous with transdermal routes of drug administration. Also see the benefits of oral route in general. This slide shows a typical drug concentration versus time curve shown in blue. The green band denotes the plasma drug concentration within safe therapeutic range. There may be some side effects along with needed therapeutic effects like a combo meal at a fast food restaurant. Above this level, there may be some worrisome adverse effects or even toxic effects seen, while below this safe range the drug levels may remain in a sub-threshold zone. The highest point of the curve is the peak plasma level while the lowest point after the peak is the trough level. This curve shows the total drug concentration. One should differentiate that this total plasma drug also contains that fraction of the drug that has reached the circulation unchanged and is called bioavailability. Typical bioavailability values for drugs administered by various routes is shown. Take a close look. In mathematics, the differential equations have a base and a power similar to exponential and algebraic equations. Differential equations are the basis of zero- and first-order kinetics model. However, to make it easier to understand quickly, I would use a very simple algebraic and linear equations. This is just to clarify the concept instead of using the actual differential equations. See that first equation has all fixed or constant values showing no variability, similar to a zero-order equation. In contrast, the second equation has a variable x which can change the outcome y, hence no constant values, similar to a first-order equation. I'll show you an actual differential equation in the next slide. The zero-order kinetics would mean that the drug concentration rises or falls at a constant rate, independent of drug amount present. For example, in absorption, 10 mg per hour, whether the dose is 20 mg or 30 mg or any number. Hence a linear or straight line relationship. The first-order kinetics would mean that the drug concentration rises or falls at a rate proportional to the amount present. Most drugs, for example, in absorption, 50% per hour would suggest that 50 mg out of 100 mg dose, then 25 out of 50, then 12.5 out of 25, and so on, maintaining the same 50%. Hence an exponential or logarithmic relationship. So, in simple words, zero order means constant amount independent of initial concentration, while first order means constant proportion or percentage dependent on initial concentration. See the straight line and logarithmic relationships in absorption and elimination. The date is hypothetical in this illustration. As we know that except in the intravenous administration, all routes of administration may not show a complete absorption. Furthermore, the drugs undergo metabolic changes after absorption. Thus, only a part or fraction may reach the target in its intact form. Thus, the fraction, F, of unchanged drug reaching the systemic circulation following administration by any route is its bioavailability. It can be written as a fraction of 1 or in percent values. It is important to estimate how much drug yield is seen, and is available to exert efficacy. Especially when we are comparing two formulations of a drug or comparing two similar drugs. This estimate can be done by measuring the area under curve. The area under curve is directly proportional to dose taken, and its bioavailability. It is inversely proportional to drug elimination. The equation is shown in blue. The distinction between rate and extent of absorption is shown. The rate of absorption is determined by the site of administration and the drug formulation. Both the rate of absorption and the extent of input can influence the clinical effectiveness of a drug. For the three different dosage forms A, B and C depicted in this figure, differences in the intensity of clinical effect are expected. Dosage form B would require twice the dose to attain blood concentrations similar to dosage form A. Differences in rate of absorption as shown between A and C may become important for drugs given as a single dose. The drug from dosage form A would reach its target concentration earlier than drug from dosage form C. Concentrations from A would also reach a higher level and remain above the target concentration for a longer period. Thanks for watching. Don't forget to like, subscribe, and share. Happy learning!